Many patients choose not to go to see conventional or allopathic medical providers for a whole variety of reasons. Those patients could be kind of anti-medication, anti-pharmaceutical. They could be kind of anti-allopathic medicine. And that is a patient population that will oftentimes see naturopathic doctors. And this is an important role that we serve to kind of bridge that gap, because that patient may not have really received any medical care for years. And we order labs, we find out they have, uncontrolled diabetes, maybe are at kind of moderate to severe cardiovascular risk. And it becomes important to do some dietary counseling, but then it becomes important to consider that statin medication or, that blood sugar medication as well, to ensure that patient has appropriate medical care and that patient is receiving the standard of care. In Alaska, the challenge is we don't have any prescriptive authority.
Welcome to the East Anchorage Book Club. I'm your host, Andrew Gray. The purpose of this podcast is to tell the stories of Alaskans of interest and importance. Today's guest is Dr. Shauna Birdsall, a naturopathic doctor with over 25 years of experience in integrative oncology. After earning her naturopathic medical degree in Oregon, she did a residency in oncology in Illinois. She later practiced in Arizona, and then from there ventured to Alaska in 2019, where she practiced along allopathic physicians in the MatSu, Soldotna, and here in Anchorage. Allopathic medicine is the medicine that most of us think of as traditional medicine. MDs, DOs, nurse practitioners, and physician assistants like myself are part of the allopathic medical tradition, while naturopaths are the alternative medical tradition. But as you will hear from our guest today, the two are not mutually exclusive. During the course of today's conversation, we will reference House Bill 147, sponsored by Representative Mike Prox of North Pole. That legislation would grant Alaska naturopaths the ability to write prescriptions for certain allopathic medications.
Dr. Shauna Birdsall, welcome to the podcast.
Thank you so much. I'm so excited to be talking with you today.
So you are a naturopath doctor. And for folks who may not know what that is a naturopath doctor?
Naturopathic doctors specialize in natural medicine. We really focus on prevention of disease and providing long-term health and wellness strategies for patients. However, having said that, we are trained as primary care doctors and receive the same conventional medical training that our MD and DO colleagues do. But then our emphasis clinically is on providing natural medical care.
And where did you go to school?
I went to school at National University of Natural Medicine in Portland, Oregon.
I think a lot of people make assumptions about naturopathic doctors. Tell us a little bit more about what your education involved.
Absolutely. And yes, I agree with you. There are a lot of assumptions made. And I will say that if any of the listeners have gone to see a naturopathic medicine doctor or maybe several different naturopathic doctors, they may have experienced slightly different types of care. And my profession is definitely on a spectrum, I will say, in terms of practice styles. However, our education is very similar at all of the naturopathic medical schools that we attend. And those medical schools are accredited, and we receive approximately 4,000 hours of clinical and classroom training. Initially, our focus is on the biomedical sciences. That includes anatomy, physiology, biochemistry. Clinically, we focus on pharmacology, nutrition, physical medicine, behavioral therapy, and counseling. And then there are electives which lead naturopathic doctors to specialize in different types of therapies. And then as we go further in our training and into residency, we may then further specialize in, say, women's health, or in my case, in integrative oncology, which is using naturopathic medicine in cancer patients in addition to their conventional cancer care.
I definitely am going to want to talk about integrative oncology, but let's just talk about you. Where did you grow up?
Oh, I grew up all over. I was born in Laramie, Wyoming, but my parents lived in Walden, Colorado, which was across the Continental Divide. And I grew up in Washington State, Idaho, Northern California, and Southern Oregon.
And when did you know what you wanted to do with your life?
Not until I was in college. I went to University of California at Davis, and I initially
For
I
undergrad?
was for undergrad. Thank you. And I was initially very interested in pursuing veterinary medicine. I'm a horsewoman, and as part of the requirements for application to veterinary school, you had to do 200 hours of observation, and I eventually realized that I could continue to be a horsewoman, but maybe not be a horse veterinarian. And there was a career fair at my school, and I learned about naturopathic medicine. And I was so excited because I grew up with parents that took me to various practitioners that I would classify more as kind of woo-woo practitioners.
Mhm.
And I was always interested in natural medicine, but I am too heavily scientific to just accept sort of a woo-woo style of
Well,
practicing.
spell that out a little bit more. What's an example of like a woo-woo practitioner that your parents took you to?
Sure. In Northern California, in particular, at the time, there was a prevalence of practitioners that didn't have any solid clinical training, and so we call them kind of diploma mill un-NDs, kind of people who would kind of claim to be naturopathic doctors. And at the time, California was not licensing naturopathic providers, so there was no protection of that title. And so the public couldn't tell kind of who really had legitimate naturopathic medical training and who did not. And so I grew up seeing providers who did not, who, might recommend a variety of herbs and nutrition kinds of recommendations that all in all probably weren't going to hurt anything. But had I actually had something seriously going on, they wouldn't have been able to appropriately diagnose it or treat it either, which is
Got it.
always the risk.
Well, my dad was an orthopedic physician, and he had a pretty low opinion of all other types of medical practitioners. And what he often said was that, like, time is the best medicine. Most people, most of the time, get better if you do nothing. And I think that's kind of true. And I think that that's kind of allowed, certain practitioners to flourish, because if they're not harming you, young, healthy people get better. So I would think that that it's possible for those people to do well, but then the problem happens when you actually have somebody who really does have something wrong that requires a specific treatment, and that person doesn't know how to do it.
Correct. And then I would say that we're even more so at risk with the state of health of kind of our adult population in the US these days, in terms of really the struggle with obesity and other, signs and symptoms of metabolic disorders, high blood pressure, high cholesterol, diabetes, and, our overall concern that, in fact, those diseases may lead to more significant cardiovascular disease and even things like Alzheimer's and dementia. So I would say the risk is that our adult population needs appropriate diagnosis and appropriate treatment.
Mm-hmm. I'm just going to make an assumption that your parents were hippies. I mean, if they were taking
They were hippies.
Yeah.
I was thinking about your question prior to this podcast and how to answer it. And I thought I always answered that my parents were hippies. And I thought, what if people don't really understand what hippies really were anymore? And so I'm glad you said that, because yes, my parents were hippies.
I've lived in Northern California before. I've had friends in Northern California. I don't know why that particular region of our country tends to attract folks like that, but I don't know. There's like lots of smoothie bars, juice bars,
Yes.
It's just a very, let's have organic smoothies every day.
Yes.
Yeah.
Yes.
So that was the environment you grew up in. And
That was the environment. Yes.
And what's interesting, of course, is that we're hearing you tell your story about your parents taking you to woo-woo not really naturopaths, folks calling themselves naturopaths. And, you became a naturopath formally doing the 4 years of naturopathic medical school because you really cared about science and wanted the rigor and the how to diagnose and how to properly treat. I think for so many folks who aren't familiar, they think of you think of those folks that your parents took you to as a child.
Absolutely. So I'm sure we'll get to it, but I have spent my career working with conventional medical providers. And in general, I would say that when we first meet and as they're getting to know me, they either overtly state that that's been their experience and that's what they're thinking of me, or in the very least, I know they're probably thinking it. And I always see it as a great opportunity to help bridge the gap and help them understand what naturopathic doctors really are and how we're trained and how we practice.
And you know what? This might be the moment for me to disclose, like as a physician assistant who worked in the allopathic medical world for many years, I have probably my own internalized biases. I have a younger brother who was taking a lot of red rice yeast for his cholesterol. And we had like a conversation about it, about someone trained in my field would say, why don't you just go on a statin? And we had this argument and he was like, well, I'd prefer to do a more natural way. And I'm like, right, but you're taking like tons of this red rice yeast, whereas you could take this teeny tiny rosuvastatin Crestor pill and you're going to get a bigger bang for your buck with this teeny tiny pill and probably will have less side effects than taking all of this red rice yeast. And, from my perspective, I've always been a little bit suspicious of like, well, I want to do it a quote more natural way because the traditional prescription medications that we got started as plant substances. And like, that's where we developed our medications from. And then we used science to make them more pure. And I don't know, I'm just being honest.
I think that's perfect. And you bring up a number of good points, and I'm going to try to hit on all of them.
Okay.
First of all, as I mentioned earlier, there is a spectrum of naturopathic doctors. I will disclose that I was trained after naturopathic medical school in a very conventional setting, a hospital-based comprehensive cancer center, and had the opportunity to be exposed to not only medical, surgical, and radiation oncologists, but also gastroenterologists, pulmonologists, intensivists, hospitalists, all of the other specialties that help take care of our cancer patient population. And so on the one hand, I had my naturopathic medical training, but then I had 2 years of a residency in this setting. And then I stayed and worked there for another 16 years. And so I am on the very conventional side of the spectrum of naturopathic medicine. There are naturopathic medical doctors that would prefer not to ever say prescribe a prescription medication and may only recommend herbs, supplements, nutrition, exercise, lifestyle changes to their patients. So I think that that's a fair point and important to know. Another thing that you hit on that I think is huge is supplement safety. And I think that's one of the really important places that naturopathic medicine can intervene with a patient. As we all know, the supplement industry is a probably billion-dollar industry. And there's all kinds of problems with product quality. Does this supplement even have what it says it has in it? We know, for example, in those red yeast rice products that many of them don't even have the natural statin containing compounds in them. And if they don't have the natural statins in them, they're not even going to be effective for high cholesterol. But also there is a growing concern over seeing a number of supplements causing something called a hepatotoxicity, which means damage to the liver. And there's a growing amount of concern over the patients presenting with elevated liver enzymes that may actually be due to one of the, natural interventions, one of the supplements that they were taking. And so I think it's also a valid concern that you had. You were valid in a number of points of your concerns over your brother's situation, but taking high doses of red yeast rice extract may very well have been, possibly even hurting his liver.
Thank you for that. That's reassuring. And I guess let's talk about working in integrative oncology. So it sounds like you did 16 years in Oregon where you'd gone to school.
No, sorry, I didn't clarify that.
Okay.
So my naturopathic medical program was a 4-year medical program, and then I was accepted into an integrative oncology residency, and that was at Cancer Treatment Centers of America in Northern Illinois. And I did a residency there and then stayed on as a naturopathic provider and also trained residents, saw patients, and that was until 2008. And in 2008, Cancer Treatment Centers of America expanded into Arizona and opened a hospital-based cancer center there. And I was given the opportunities to start the naturopathic medicine program there and ultimately became the director and had 8 naturopathic doctors on my team providing care to patients. We provided care in a team-based approach with our medical oncologists, radiation oncologists, and surgical oncologists.
And was it from there that you began working with Katmai Oncology in Anchorage?
So in 2019,
a long time now.
So I was in Arizona until 2019, and then started coming up to Anchorage. And originally it was with Alaska Oncology Associates, who were acquired by Aurora Integrated Oncology Foundation. And I worked at Anchorage Radiation Oncology Center in Midtown and at Peninsula Radiation Oncology Center in Soldotna at Central Peninsula Hospital, and then at MatSu Valley Cancer Center in Palmer.
Oh, wow. You were all over.
I was.
Tell us a little bit about what you did with patients that you were seeing who were going through chemo or radiation for whatever type of cancer they had.
A number of things. Cancer patients in general are a very vulnerable patient population, as you can imagine. Patients receive a diagnosis and immediately start going through kind of almost a soul-searching experience of, what could I possibly have done that could have caused this, and what can I do to prevent this from coming back and or treat it. So they may be at that same time going through all the diagnostics for their cancer and or even starting treatment. But in the meantime, they're frantically searching on the internet, and always their family members, friends are also searching. And so by the time they come to me, whether they've just been diagnosed or whether they're in the middle of their cancer treatment, they're generally taking a number of supplements. They've completely changed their diet. They're dealing with, treatment-related side effects. And so I do a thorough evaluation of exactly what they're taking, exactly, what their diet looks like now, how they're tolerating treatment, what their side effects and other symptoms are, and then go from there. One of the areas that I've always been really passionate about is prevention of drug-herb-nutrient interactions with chemotherapy. And now we have a variety of targeted agents, immunotherapies, and endocrine therapies. And I won't go too much in depth, but basically, there are a number of cancer treatments that supplements can either help, hurt, or kind of neutral with. And that's because a lot of supplements affect the way that the liver metabolizes chemotherapy drugs and other cancer treatment drugs. And so one of the first kind of areas that I'm always addressing with the patient is whether they're supplements are interacting or not with their treatment, because the last thing we want is for them to be going through the side effects of cancer treatment, but not getting all the benefits in terms of killing cancer cells. And that's always my first concern. But I'm also concerned about their financial resources. Most people don't have unlimited financial resources for their health care. Cancer care is very expensive. And I don't want patients taking any supplements that aren't actually going to be beneficial or helping them. And unfortunately, that frantic internet search rarely elicits the supplements that are actually scientifically researched to help with that cancer type or that certain chemotherapy or any of the other side effects that the patient is dealing with. So there's a lot of discussion about supplements in my visits with patients, and then also nutrition. So, patients are usually like, well, I was on the standard American diet, and so now I need to focus solely on juicing. It's kind of the type of extreme that kind of soul searching when someone's diagnosed with cancer can take them. But the risk is they actually become malnourished because they're not getting enough, say, protein. And so really making sure that they're meeting their nutritional needs, and we're taking a very scientifically evidence-based approach on what they're eating. And the other thing I'm really passionate about is lifestyle changes. There has been just a boom of research on the effects of exercise with cancer treatment. And it's pretty amazing, to the point that the American Association of Clinical Oncology has actually recommended that all medical oncologists recommend exercise for their patients. And for example, medical oncologists in Anchorage, including at Katmai Oncology, regularly refer patients to oncology rehab at Providence Hospital, where physical therapists are actually taking patients through a whole weight training program appropriate to everything that they're going through, but really helping them focus on exercise as part of their cancer treatment. And then again, I'm also addressing things like sleep, stress management, and those kinds of things.
Can you just educate our listeners? What are some common supplements that folks might find in a Google search that they would take that they think would be helpful, whether they're cancer patients or not, that actually could be harmful? What would be the most common things that you would see in your practice that somebody trying to help themselves is actually spending money on something that's actually hurting them?
So this all gets very controversial, but the most common kinds of things, and I wouldn't even classify these as supplements, but patients classify them as supplements, that cancer patients come in taking or come in asking about, are ivermectin, fenbendazole, and menbendazole. Ivermectin in particular became really popular during the COVID pandemic because of beliefs that ivermectin was helping prevent COVID or with COVID recovery. And somehow that morphed into ivermectin being a cancer treatment. And obviously COVID virus cancer are extraordinarily different diseases.
And ivermectin doesn't work for either of them.
Correct. And then menbendazole and fenbendazole came along. And patients largely are not thinking of these as drugs and not thinking of these as drugs that are unapproved for these uses. And unapproved doesn't mean that we're just looking for FDA approval. Unapproved means not researched and not shown to be efficacious. These are often sold as supplements, and patients, will frequently tell me the kind of the website that they're looking at. And the website looks very scientifically appropriate, at first glance, and even quotes, some studies. And you and I both know that there's a lot of kind of preclinical, studies where maybe we're exploring, cancer cells in a test tube and seeing if something affects them in a test tube. But oftentimes, drug companies know this quite well. Oftentimes what worked in the test tube doesn't really work in a person. And so that's, I would say those are the biggest things that patients come in. And that's wildly different from when I first started, where patients were more looking at herbs that frankly also have a lot of toxicity, something called bloodroot, or the Latin name is sanguinaria, that patients were applying topically, and it erodes tissue, and they were drinking it, in the hopes that it would erode like the tumor. And that's obviously something highly toxic. Or herbs like chaparral that are known to be hepatotoxic, known to be toxic to the liver. Those were the kinds of things that people were taking, when I first started. But, in the last 3 or 4 years, it's been the ivermectin, fenbendazole, and menbendazole, which, aren't supplements, but that's how kind of patients think about them.
Gotcha. Well, I wanted to talk about the fact that you've practiced in Illinois, you've practiced in Arizona, you've practiced in Alaska, and I would guess that all 3 states have very different ways of licensing naturopathic doctors. Can you talk a little bit about the differences?
Yes, certainly. So Illinois actually doesn't license naturopathic doctors currently, which is interesting because Illinois has naturopathic medical school in it. So in Illinois, I practiced in an unlicensed state, and I practiced in, a highly integrated cancer center. So I was providing supplement counseling and nutrition recommendations under the guidance, of a medical oncologist and kind of well within kind of a rigorous hospital-based system. And so that was a very sort of limited scope, if you will. In contrast to when I went to Arizona naturopathic doctors practice to their full scope, which means ordering labs, ordering other diagnostic tests, but then also prescribing medications. In Arizona, the only medications that we can't prescribe are controlled substances, cancer, chemotherapy, and antipsychotics. But other than that, we have full prescriptive authority. And you might be thinking, or the listener might be thinking, why does it matter if you have full prescriptive authority if you're a natural medicine doctor? And it matters in the context of working as a primary care physician for patients. And I'm kind of going to bridge what I'm going to say into Alaska as well. Many patients choose not to go to see conventional or allopathic medical providers for a whole variety of reasons. Those patients could be kind of anti-medication, anti-pharmaceutical. They could be kind of anti-allopathic medicine. And that is a patient population that will oftentimes see naturopathic doctors. And this is an important role that we serve to kind of bridge that gap, because that patient may not have really received any medical care for years. And we order labs, we do some additional diagnostics, we find out they have, uncontrolled diabetes, maybe are at kind of moderate to severe cardiovascular risk. And it becomes important to do some dietary counseling, potentially look at, their vitamin D deficiency and supplement with vitamin D. But then it becomes important to consider that statin medication or, that blood sugar medication as well, to ensure that patient has appropriate medical care and that patient is receiving the standard of care. In Alaska, Alaska is a very interesting state. Alaska had a naturopathic license bill approved in 1986. In Alaska, we can order the diagnostics. So we can order all the lab work. We could order an MRI. We could, diagnose a patient, say with cancer. As naturopathic doctors, we're trained to refer when appropriate. The challenge is we don't have any prescriptive authority. And so if a mom brings her daughter in at 4:30 p.m. on a Friday with a sore throat and I diagnosed her with strep throat. As a naturopathic doctor in Alaska, I can't prescribe antibiotics for her daughter's strep throat. And now I've got to send her to an urgent care if there happens to be one, if, say, she's in Anchorage. But if she's in one of the more rural communities, she might have to go to an emergency room to get the antibiotics, because if that patient is not an established patient with another primary care doctor, no one's going to see her at 4:30 p.m. on a Friday as a new patient. And so that's where the concern comes into place for naturopathic doctors in Alaska not having prescriptive authority.
We have a bill that's been kind of working its way through the legislature to give naturopaths prescriptive authority. And hearing the debates on that bill, have been really interesting. And I think the example that they often use is an adult female patient who has a UTI. And
Mm,
that adult female patient has an obvious UTI, very easy to
mm,
treat, and
mm,
the naturopath can't write the prescription. So
mm.
after they've done their appointment with the naturopath, then they have to go to a separate appointment with primary care or urgent care or the ER, which is really an appropriate use of the ER. Uh,
Exactly, exactly.
and so it really is this sort of like duplicative
Yes,
service that's happening. But
yes.
what we hear from, full disclosure for listeners, I'm a co-sponsor of the bill to grant naturopaths prescriptive authority. To me, it is essential that we expand access to primary care in Alaska, that we expand access to care, period. And as you were just speaking about, Dr. Birdsall, there are many folks in Alaska who would prefer to see a naturopath over a traditional primary care doctor or nurse practitioner or PA. They would prefer to see that naturopath. And I just think that creating a system that is going to cost more for everybody is inappropriate and wrong. That said, the concerns that the allopathic practitioners have is that there will be inappropriate prescriptions happening from naturopaths because they're not properly trained to do that type of work. They don't know how to write prescriptions. They'll write the wrong prescriptions and it will be harmful to patients. We've heard it on the record. They say it frequently. And so you've already done so in this podcast, but can you respond to those folks again?
Sure, I'd love to. So, first of all, we do have appropriate training. We have appropriate training during naturopathic medical school in pharmacology. We have several years of pharmacology courses. And then we have appropriate clinical training where we're supervised in clinic and are treating and prescribing. And then we have national board exams to ensure that we're clinically competent, including in pharmacology. And then there are other states that have additional pharmacology exam requirements for physicians who have not been currently prescribing. And my understanding as part of that bill was that there was an inclusion of a pharmacology exam and then supervision under an appropriate medical or osteopathic physician for naturopathic doctors initially in Alaska to ensure competency with kind of prescriptive authority, unsupervised being granted once that supervising physician felt that the naturopathic doctor was indeed clinically competent.
That is correct. And I'll just say that that's the current version of the bill. The previous versions of the bill were more liberal, I think, in the prescriptive authority granted to naturopaths. The sponsor of the bill is Mike Prox from North Pole, Alaska. He has scaled back that bill repeatedly. So, I mean, I feel like now it is just the smallest baby step towards granting prescriptive authority to naturopaths. And yet we still have a lot of pushback. We still have folks. I'm going to be perfectly blunt with you. Other legislators, I told them that I was having a naturopath on the podcast, and they literally groaned and were like, oh no, because they don't want to talk about it. And I think without trying to throw too many folks under the bus, a lot of folks in Alaska, we don't know any naturopaths. They don't have any relationship with naturopaths because we don't have prescriptive authority. We're not as attractive a state for naturopaths to live and practice in. And because of that, because there's so few naturopaths, it becomes an incredibly uphill climb to get folks to help something they're completely unfamiliar with and don't understand. And the people that they are familiar with, which is their doctor, their nurse practitioner, their primary care provider, is telling them that this is unnecessary and that they don't really support that bill.
You know, it's so interesting. First of all, I understand where they're coming from. I understand their concerns. I understand maybe some previous experiences. I understand their biases. Like I said, I have spent my career working with conventional medical providers, both under the same roof, and then the majority of my patients were referred by, their primary care, and or their medical oncologist. Um, and in order to earn those referrals, you have to prove yourself as clinically competent. And so I've spent my career making sure that I'm proving that I'm clinically competent. However, I understand their concerns because over the course of my 25-year career, I have run into naturopathic doctors that I would groan and eye roll and, have those same sorts of reactions to. So their concerns are not unfounded. I will say that unfortunately, Alaska, as you've stated as well, it's hard to recruit naturopathic doctors for. In fact, I retired from clinical practice at the end of October and recruited for my replacement. And we ended up recruiting one of the naturopathic doctors that had been working for me in Arizona to take over the role that I previously shared that I had. But she was understandably, justifiably concerned about coming to a state with such a limited scope of practice. And, had she not been given the opportunity to kind of practice in the same environment that we were practicing in Arizona in terms of providing team-based care with our conventional oncology colleagues, I don't think I could have recruited her to Alaska. And so it is a significant problem. And, it's interesting to me, I was reflecting when you were talking on the fact that a medical profession, in this case, naturopathic medicine, asking to be able to practice their full scope per their training and education becomes a political conflict for, a whole variety of reasons. And it's interesting that in the U.S., how physician assistants are able to practice, nurse practitioners, and others in our field, all comes down to sort of a political debate and political conflict rather than a medical kind of overview and medical determination of what might be appropriate.
Yeah, it turns into a turf war. And one thing, I don't know if people are comfortable commenting on this, but I think one of the negative side effects of Alaska's restricted environment for naturopaths is I think that we actually have a disproportionate number of naturopaths that actually cause people to groan. That the naturopaths who do choose to practice in Alaska are the ones who exclusively use supplements, who exclusively use herbals, because they don't have access to traditional prescription medication. And therefore, they might actually be very hostile towards traditional medication. And therefore, the more traditional practitioners who only interact or hear about that particular naturopath are going to have a very negative impression.
I agree. I think, unfortunately, the majority of my profession works in a, private practice environment where you're kind of a single island in your practice, and working in a more collaborative environment and, kind of being under the same roof as I've always practiced with MD and DO colleagues, as well as PAs and NPs, being all under the same roof, or in the very least as part of collaborative care teams for patients, is really eye-opening for people. And everybody kind of needs to acknowledge, and they're exposed to everybody's particular clinical competencies, if you will, versus a naturopathic doctor in private practice maybe having made an impression on an internal medicine doc when they offered that patient red yeast rice extract, for example, when, maybe the patient is at like severe cardiac risk and really needs to be placed on a statin to prevent,
Heart attack and stroke.
Event. Right. And then, that's where, the suspicion starts and the concern starts, and it justifiably so and understandably so.
Well, to finish up, I'm super grateful for you coming on the show today. And I think it's eye-opening for folks to hear directly from a naturopath who's had experience in multiple states. And I believe at this point in the conversation, I think folks are going to trust your advice. Can you give listeners just some advice about supplements that are worthwhile, supplements that are not worthwhile? Just any advice that you might offer listeners who want to be optimally healthy and not waste their money on things that are going to do nothing.
Absolutely. Alaska's easy for this first recommendation, and I think you'll agree with me. Everybody should have their vitamin D level tested. And if their vitamin D level is not optimal, they need to be on a vitamin D supplement.
Hey, I would go further and say if you live in Alaska, your vitamin D level is suboptimal and you need to be on a supplement.
Yes. So that's just a gimme right there. And then from there, supplements go through fads. With social media influencers are frequently trying to sell products. So as a patient, always be a little bit suspicious if you're either getting targeted social media ads and or social media influencers who are not clinicians are making supplement claims. But many people could benefit from an omega-3 supplement. Omega-3 is fish oil, but there's a caveat to that in Alaska, in Alaska, not everyone, but many people are eating a larger quantity of salmon, and salmon is a good source of omega-3s. So depending upon your salmon intake, and I do realize that there's some Alaskans that don't eat it, considering an omega-3 supplement, the research keeps kind of going back and forth on the role of omega-3 and cardiovascular disease prevention. But omega-3s play a role in mood, and certainly many Alaskans, suffer from seasonal affective disorder in the wintertime. And so omega-3 is something worth looking at.
Hey, I'm going to throw in something there because what my understanding of omega-3s are, and it may not be as up to date as yours, is that it's always better to get your omega-3 from a natural source than from the supplement. And so if you're getting enough omega-3s from your fish intake, then that's optimal. Like that's correct. You would prefer to get your omega-3s from the natural source, from the whole food,
correct,
rather than a capsule. And so I don't know if you could just comment on that.
I'd love to. So absolutely. And there are a number of Alaskans that are eating salmon. As I shared, I did have some patients that were like, I can't eat it. And, another good source of omega-3s or other fatty fish like sardines. Sardines are certainly not for everybody in terms of tolerability, in terms of likability. Mackerel. The plant-based omega-3s get a little bit debatable as to whether we're actually converting the omega-3s appropriately. Always, food is better. Food sources are better than supplements. The exception with vitamin D, as we were sharing earlier, is you really can't get enough vitamin D, especially as an Alaskan, through your food. And while I would love to say go expose yourself to sunlight, I looked at your weather today. It's not going to be happening.
Yeah, not a lot of natural sun today.
And so if the listeners can get their omega-3 from food, always better. If they're not getting it from food, that's where an omega-3 supplement comes in.
Hey, one last question before you go. A lot of creatine, which is kind of like for years and years was like a weightlifter's supplement. And we've seen some studies in the last year showing it helps with dementia patients, like perhaps with mental focus, that it actually can be helpful to even people who aren't bodybuilders. Have you been following that at all? And do you have anything to say?
I have been. So a secret about me is I totally follow social media because I want to see what my patients are getting exposed to, so that when they come in with various questions, I've already gone to PubMed and read the research or the lack of research, and I'm already prepared to have the conversation about the supplement du jour. And so when they first started coming in asking about creatine, honestly, I thought, no, like this is a bodybuilding supplement. But in recent years, there's been a plethora of research that's fascinating on creatine and definitely showing some cognitive benefits. And as we age, and especially, as women go through menopause, we start to develop some cognitive changes where creatine could be of benefit. Many of us are not getting adequate protein and doing adequate strength training, which we need to be doing. However, creatine is also an addition to protein and strength training for helping to build and maintain muscle mass, which becomes increasingly important as we age.
Final question. The current federal administration and with RFK Jr. as Secretary of Health, I would think that there are certain things that he's doing that naturopaths would like. I think in terms of like a focus more on preventative medicine, perhaps a focus more on diet and exercise. But I'm curious if you feel comfortable giving your thoughts. Obviously, I have real problems with the changing of the CDC's vaccine schedule and the basically increase in suspicion and skepticism about the value of vaccinations. And I don't know if you can comment at all on that.
I would love to comment. So, as you can well imagine, being a naturopathic doctor that kind of prides myself on being up to date on science, being considered clinically competent, and I oftentimes become concerned when I see a situation like with Robert Kennedy Jr. kind of shining what I would consider a concerning light on health and wellness and disease prevention that the public could interpret as possibly being aligned with naturopathic medicine philosophy, if you will. Mm-hmm. I too am very concerned about changing the CDC guidelines for vaccines. And it was initially concerned when the changes came out, even, with the COVID vaccine, particularly for implications for healthcare workers. And I was kind of dismayed when the focus was on just kind of removing food dyes from ultra-processed foods, because I think we all know this, but we should be cutting down and or eliminating our consumption of ultra-processed food for obvious health reasons. I don't think just removing a certain red dye is necessarily going to make our nation healthier. I do think that there has some good that's come out of it. I don't know if you've seen in the last couple of days the changes to the food pyramid.
Talk about that.
Guidelines. Yeah. So the changes, so they kind of flipped it. So instead of being, I think it was like 8 to 11 servings of whole grains a day, which, these days with our concern about metabolic syndrome becomes a little bit concerning. They flipped it, and protein is now one of the major macronutrients, and the recommendation is 1.2 to 1.6 grams of protein per kilogram. And of course, none of us in the US think in kilograms. But as an example, with kind of a normal body weight woman, that puts me in like 68 to 92 grams of protein a day, which is in line kind of with the way I've been eating per the scientific research. And then, also continues to focus on fruit and vegetable intake, but then, decreases the recommendation for whole grains to more like 2 to 4 servings a day, which is still a lot of whole grains. Mm-hmm. Also recommending that Americans eat more home-cooked meals, less ultra-processed food, looking at the kinds of fats that we're eating, yet still keeping the guideline on not more than 10% saturated fat. And in fact, the American Medical Association came out kind of congratulating and having a positive viewpoint of these changes to the food pyramid. So I think that was a good step, but I have been dismayed, as you have been, about changes to the CDC guidelines with vaccines.
So I will just say that the reason why I was distracted by that food pyramid day is because Dr. Oz also gave a press conference where he talked about alcohol. I'm sort of the anti-alcohol office, and we actually got the signage changed throughout Alaska, that our signs at all points of sale in Alaska now warn that alcohol is a risk factor for breast and colon cancer. And
yes.
And I want people to know that. And the fact that the federal government is no longer warning of the cancer risk of alcohol is problematic to me. And also the fact that it used to be no more than 2 alcoholic beverages per day for a man and no more than 1 alcoholic beverage for a woman. They removed those specific recommendations and just left it more general, moderation. And that I think is problematic. I think anything that allows somebody to think that they can drink more alcohol and be healthy is not a good idea to me.
I agree with you. I share your concern, and I was dismayed as well. And I will share that, over the course of 25 years in counseling my patients, as you can imagine, every patient I saw, I counseled about alcohol. And I will share that many patients really had no idea. They thought, well, if I'm drinking, 1 drink a day as a woman, or 2 drinks a day as a man, that's considered
Risk-free.
safe.
Yeah.
And they were actually surprised that it was carcinogenic. I think what I find dismaying, kind of, if we wanted to put an overall umbrella on kind of where things are going, is not looking at the scientific research. For me, constantly kind of critically looking at the scientific research is what should be guiding our policy and particularly our health recommendations. And that seemed like disregard for where the scientific research is right now.
Well, Dr. Shauna Birdsall, thank you so much for being on the show today. Thanks for being extra generous with your time. I sincerely appreciate it.
My absolute pleasure.
Thank you, listeners. If you like what you heard, please subscribe, rate, and review us. To contact me, email rep.andrew.gray at intellective or call 907-269-0123.